going to have the opening remarks. And ideally, as I told you, this is going to be super interesting because we want you to ask all your questions. And in the next 2 hours, we want all your questions answered by the experts who are going to be speaking. So I'm going to call out to Niluka. I think I saw Niluka somewhere. Niluka, are you on the call?
Yes, I am.
Yeah, there you are. Okay, over to you.
Great. Thank you so much for INASO, INASO and Anglophone Africa Learning Hub for putting this together. And I think technical assistance is one of the key areas that we want communities and civil society to be aware of. What kind of technical mechanisms are available in our regions, what kind of technical assistance is supported, and how to apply. And also importantly, who is there for us to help to apply for these technical mechanisms. So as Glory has been repeating herself, please do ask questions as much as possible. This session is for us to give as much as possible information to you. We have Global Fund Community Engagement Strategic Initiative here, and I'm sure we have UNAIDS, Expertise France, and other TA mechanisms available. So make note of all the questions, and when we come to question and answer session, please shoot them, and we are ready here to provide you with the answers. The Learning Hub, Anglophone Africa Learning Hub, is also ready here to support you with your applications. So let's have a great webinar and a great discussion session. Over to you, Glory.
Great. What I like with Niluka is how he confuses Lizzie and Glory. I like that much because I can ride on Glory's experience and pace. So I love that. Thank you very much, Niluka. No worries. No worries. I like when that happens. So ladies and gentlemen, the way Niluka put it, it's all about knowing what TA is, how you can access it, what it's all about, and the do's and don'ts. And we know there are a lot of questions that also came in during registrations. So let's just dive into the discussions today. I'm assuming I'm calling Glory next.
It's Niluka.
I was going to ask because he spoke and then he kept quiet. So Niluka, this is how
great.
it's going to go down. As per the agenda,
yeah.
as per the agenda that I have, you're going to be the first speaker, and we're looking at understanding now TA support, now technical assistance support, and we're trying to understand what that is. And of course, as I mentioned, ladies and gentlemen, we have a lot of people who are going to speak. These are key experts and people who actually provide this. So I'm assuming by the time the presentations from the speakers is done, we'll be having a clearer idea on how to access TA, what it's all about, and also who's providing this TA. So Niluka from the Global Fund is going to give us an overview of the community engagement technical assistance bit. So Niluka, over to you.
Thank you, Lissy. I got the name right this time. Hello, everyone. My name is Niluka, and I am a senior programs officer at Community Rights and Gender Department at the Global Fund. And I am also the focal point for technical assistance from the Community Engagement Strategic Initiative in Asia Pacific region and Eastern Europe and Central Asia region. So today I'm going to take you through the short-term technical assistance of Global Fund Community Strategic Initiative. Next slide, please. The overall objective of Community Engagement Strategic Initiative TA is to strengthen community engagement and leadership in Global Fund and related processes throughout the grant cycle. So we are looking at how to support communities to engage meaningfully, effectively, and how to strengthen their leadership in related processes around Global Fund and other national processes. Next slide, please. So the Community Engagement Strategic Initiative have 3 components, but today we are going to look at component 1, which is short-term peer-to-peer technical assistance. We also have a component on long-term capacity strengthening of key and vulnerable networks, networks of key and vulnerable populations. So we have global networks of key and vulnerable networks. And then component 3, which is regional learning hubs, which is also Anglophone Africa Learning Hub. One of them, we have 6 across the globe. Next slide, please. Great. So who is who? We have in the short-term TA technical assistance program, we have 19 pre-selected TA providers. So when we look at them, you can see on the screen left top corner, the 19 technical assistance providers. But most of the TA providers among these 19 are have the capacity to provide TA in Anglophone Africa region. And in the component 2, which is long-term capacity strengthening support, we have number of priority countries in the Anglophone Africa region. Next slide, please. Okay, so this is the most important slide. Short-term TA, what it is, what is on the menu, and what are other particular information around it. So in the short-term TA, we can support what you see on the left side of the screen. These are the 4 priority areas: situation analysis and needs assessment. So in preparation for funding requests or in preparation for implementation of the grants, if there is a need to do a situation analysis and a need assessment among key and vulnerable population, this is an area that we can support with technical assistance. The second area is engagement support in country dialogue across the grants life cycle. In our experience, we have been supporting a number of countries to prepare for the country dialogue, to prepare community priorities and validate them with communities. There were also TAs that were provided around the community priority annex. The third area is engagement support in program design and oversight of Global Fund grant implementation. So around TA around grant implementation, building capacity and awareness of communities and civil society on Global Fund and its processes, meaningful community engagement or strengthening community engagement in different Global Fund implementation processes, including with CCMs, areas such as that. And then we also support engagement in national strategic plan reviews and developments. Now, what do we do not support? So we cannot support CCM strengthening, long-term capacity development of civil society networks and organizations. So we cannot, through this short-term TA, we cannot provide support to organizational development. Development of standalone tools. So for instance, if a country or communities need to develop a certain tool which is not really related with the Global Fund or Global Fund processes, then we cannot support that kind of standalone tools development. And then funding request writing. This is also not within the TA, short-term TA support that we can provide. What's the timeline? So once a TA application gets to us, and I will shortly talk about the application process, we need at least about 3 months to mobilize expertise and go through all the procurement processes. And the usual time period of implementation is 3 months. Hence, this is called short-term TA. A key component of the short-term TA is we can support expert days of up to 30 days. So what we usually do is we support a team of consultants, a combination of international and national consultants, up to about 30 days altogether, who will be providing support to communities and civil society in the respective country. A key component of the TA is the peer-to-peer approach, because as communities, we do have a lot of expertise and knowledge experience. And through the TA, we try to create this platform where peer-to-peer exchange could happen easily and smoothly among communities around particular issues. Next slide, please. Okay. Sorry. Yeah. Okay. This is what we see from last cycle TA assignments that were provided in the Anglophone Africa region. These slides will be shared with you, but altogether, 37 TA assignments were supported in Anglophone Africa under the strategic initiative, the short-term technical assistance in grant cycle 6. Next slide, please. Okay, this is the timeline. So how does a TA application and a TA assignment takes place? So once communities identify in a particular country that they need TA support, we need to start developing a TA application. And this is where Anglophone Africa Learning Hub comes into play. Anglophone Africa Learning Hub, led by INASO, is supporting community and civil society in respective countries to develop their application TA application. So they will be supporting in aligning the objectives, making sure the objectives and the TA is aligned with country priorities and country grants. They will also liaise with us to make sure that it's within the eligibility criteria of the TA. So once the TA application is submitted to us, and I will also share a link shortly on the chat where you can access the technical guidance for TA and the TA application form. It comes to Global Fund, and within the Global Fund, we do a eligibility check. So we check with the country teams, we check with our investment support advisors, the eligibility of it. Once it is eligible and we approve the TA request, then it goes to the stage of mobilizing experts. So we reach out to the pre-selected TA providers, and we ask them to share with us CVs for a team of consultants. And the TA provider would work closely with the TA applicant as well to identify national consultants. Once the once the experts are mobilized and the contract are signed, the TA implementation starts. TA implementation, as I mentioned earlier, is close to a 3-month period. So once the TA is completed and all the deliverables are completed, after about 3 to 6 months, from our end, we do a survey to check with the TA applicants and other related parties of their satisfaction level, whether the TA contributed to their to achieve the objectives mentioned. So that, at the bottom, you see from application to mobilization of experts, it's about 3 months. We support approximately 30 expert days and up to 3 months in terms of implementation. And after about 9 months, we will be doing the satisfactory surveys. Next slide, please. Okay, so just to wrap up, what's new in GC7 cycle and the short-term TA? This time our budget is reduced. So, there is limited opportunities for TA over the course of 3 years, and they are also spread among the 6 regions. And then we do have updated pool of pre-qualified TA providers, 19. Some of them are also coming from the Anglophone Africa region, and most of them have the capacity to provide TA in the region. We have updated TA guidance material. I will share the link for this in the chat shortly. And something new is the post-TA survey, which takes place between 6 to 9 months. Once a TA is completed, we want to see whether the TA applicant is satisfied, whether the deliverables were used as they were expected. And importantly, please note the new email address. The TA applications should be sent to this particular email address to be considered. Now, you are more than welcome to go and visit the Global Fund webpage. I will share the link soon, and take a look at the TA guideline, technical guidelines. But we would really encourage you to reach out to ENASO and Anglophone Africa Learning Hub if you are willing to apply for TA. They will be supporting you throughout the TA application process, ensuring that you have a higher rate of eligibility. Let me stop here, and thank you so much, Lissy. Over to you.
Great, thank you. And I like your closing remarks because I was going to start with that. Ladies and gentlemen, we did tell Niluka to make his presentation a bit brief, so hence the number of slides. I know he has an immense amount of data he'd like to share, but even if you did not understand, yes, if you didn't understand the whole presentation that he made, do not worry. That is why ENASO is hosting this discussion, and that's why ENASO exists. So we do offer TA assistance. I've just seen something pop on my screen, so it distracted me. TA assistance. And of course, our team later on, as the call goes, will let you know how to, reach out to ENASO and get that assistance in. So the next presentation, also looking at an overview of the UNAIDS technical assistance support system. We have Caroline. I will not butcher your last name, but I'm assuming, Caroline, you're already on the call.
Yes, I am.
There you are. Please, before I start, Caroline, how do I pronounce your last name?
Chacho.
Okay, I'll
They don't pronounce the N.
Okay, Chacho, is it?
Yes.
Got it. Perfect. Okay, over to you, Caroline.
Okay, thank you very much. My name is Caroline Chacho. I'm technical officer at UNAIDS. I'm the focal point for TA TA requests for WCA region, ECA region, and ESA region. I will talk about the UNAID technical support. Next slide, please. There's something I cannot see the presentation.
Oh, okay. It's we can see it.
Okay.
I don't know. Yes.
Okay, thank you very much. So I'll talk about the UNAID technical support mechanism. It's a mechanism that provides short-term support to countries to support development of global funding requests, as well as removal of bottlenecks in grant implementation to effectively respond to the HIV epidemic. It is a country-driven mechanism that includes the global fund building blocks. It ensures that investment made in country response to HIV by PEPFAR and Global Fund achieve optimal impact and country have well-functioning of effective national HIV programs. It reaches those who are underserved and at higher risk of HIV. It shapes public policy on HIV. It reduces inequities through leveraging UNAID structures with government, communities, and partners. The technical support is provided mainly through local and regional consultants, and the technical support mechanism is funded mainly by US government as part of its 50% holdback during funding to Global Fund. Next slide, please. TSM has 4 result areas. The first one is harnessing, utilizing data. The second one is accelerating implementation to close gap, especially HIV prevention and treatment gap, including through community-led response with an emphasis to access services to reach children, adolescent girls and young women, and other key and vulnerable population. The third area is accelerating implementation for policy, law reform, human rights, and gender that is aimed in improving human rights and gender equality and reducing stigma and discrimination. The last one is promoting equitable financing and sustaining the HIV response. Next slide, please. Here you have a lot of technical support requests that we receive at TSM. We have the development of Global Fund application, National Strategy Plan development, midterm reviews, HIV estimate modeling, National AIDS spending assessment, integrate IBBS, key population size estimates, improving prevention programming, strengthening CSO capacities, elimination of user fees, costing of social contracting, implementation of Sigma Index 2.0, gender assessment, expansion of community-led response. Next slide, please. TSM must be catalytic. It has to be short-term and is for Global Fund HIV grant implementation or Global Fund HIV funding request. The recipients are those implementing Global Fund grants such as National PR, SR, SSR, and other national entities supporting Global Fund grant or funding request. The consultant hired through TSM cannot be used to fulfill staff function of CSO, UN, and government. TSM provides support directly to the TS recipient by paying the consultant fees and travel costs. One of the important donor criteria that TSM cannot support are legalization, discrimination of sex work, police prison authority, security law enforcement officer, military, purchasing material and equipment, providing and exchanging needles. Next slide, please. The entry point of all the technical support requests is the UNAID country office, which oversees the support to the country and engage with CSOs, government, global funds, UNAID for co-sponsors, UN donor, US government, and other partners at the country level. The UCO works with the recipient and complete the request form and also support the implementation of the technical support. TSM proposed consultants from its roster of over 1,800 consultants. TSM provides quality assurance, technical reviews, reporting, learning, and evaluation of all the TA requests. Next slide, please. Since the TSM inception in May 2018, we have received 852 requests, and the ESA has 271. We are currently implementing 125 requests, and we are supporting 90 countries. Next slide, please. This is the last slide, and you can see that all the ESA countries are eligible to receive the support from TSM. And to have all the information, you can go to the website link listed in the slide. Thank you very much, and over to you.
Thank you very much, Caroline, for that presentation. As I mentioned, sorry, we had to, limit the number of slides, but that was a lot of impactful information. At the beginning, my question is usually TA. Does that mean it's liquid cash that is coming to us directly? But looks like you've also answered and tackled that particular question. So ladies and gentlemen, that was Caroline Chacho. I've got it right, I'm assuming. Caroline Chacho from UNAIDS, and we were looking at the overview of UNAIDS technical support. And we started off by talking about community engagement technical assistance from NILUCA Global Fund. And as I mentioned, we do have a few housekeeping rules. I think it's a technical glitch, but the minute you get into the call, you're automatically unmuted. So feel free to mute yourself as we proceed with the discussions. Also, feel free to start using the Q&A section or even the chat box. I've seen a lot of people introduce themselves, and welcome on board. If you have any question, maybe directed to the previous speakers, also do type that so that we can I'll just mute Tariro real quick so that we can also address those during the Q&A session. We do have enough time for you to ask your questions and also get, the conversation engaging. But the next speaker now, who's going to look at the overview of GIZ Backup Health Technical Support. This is Katrine Hartman from GIZ Backup Health. Katrine, yeah, perfect.
Yes, hi, Lucy, thanks.
Hey, how are you?
Pronounced it correctly. I'm good. Thanks. How are you?
Good, good. I was going to ask if I butchered it. I tend to do that a lot, but over to you.
No, you did well. Thanks. Yes, hi, everyone. Good afternoon, and thanks for having me. My name is Katrine Hartmann. I'm a technical advisor for GIZ at the Global Program Health System Strengthening Backup Health. Next slide, please. Our portfolio covers different areas and includes health system strengthening, health financing, and local vaccine production. And for this meeting, I'll zoom in on the health system strengthening component, as our support to communities within the Global Fund context would mainly fall under this area. With the overall aim of strengthening health systems, we support our partners in planning and implementing global financing for health with a historically strong focus on the Global Fund. Backup was actually created in 2002, shortly after the Global Fund was created. And we do that by working together with our partners to strengthen capacities of key actors in health systems and by generating lessons learned for future planning and implementation of Global Fund funds. As you can see on the map, our focus countries for this project cycle are Central Asia, Malawi, and Nigeria, which are funded by the German Federal Ministry for Economic Cooperation and Development. And then also Mozambique, Uganda, and Zimbabwe, which are funded by the British FCDO. And I will come back to that difference here on the next slide. And we do also have further eligible countries where we have smaller support packages available, and these include Cameroon, Ethiopia, Sierra Leone, Togo, and Ukraine. Yeah. Next slide, please. I'm going to give you a little more details on the scope of our technical support. We basically aim at supporting better integration of RSSH approaches in the programming and implementation of global fund financing. And as I mentioned on the previous slide, we do that mainly by strengthening partners' capacities in this regard and by working towards providing knowledge exchanges and scalable lessons learned between the countries we support in this regard. Our core areas of intervention are selected in line with the Global Fund strategy. We focus primarily on community engagement, governance and coordination, and integrated people-centered systems. And in all our activities, we aim at incorporating gender and human rights as cross-cutting topics. And as I mentioned on the previous slide as well, there is a slight difference between the approach in the BMZ-funded countries and the FCDO-funded countries, where BMZ focuses on all those three core areas, and FCDO focuses on strengthening of civil society and community engagement in the countries that they are supporting. Backup's approach to community system strengthening is to support community engagement in global fund-related processes along the whole grant cycle. This can include actually a couple of very different measures, starting from needs assessment, going through engagement in country dialogues. It can include short-term organizational development, support to strengthening CLM activities for decision-making. So basically, it is very tailored to the needs of our partners at country level. And our technical advisors will support you in identifying TA needs and developing tailored responses to address those needs in the best way. And for that, we have different modalities of support available. One would be, as I said, direct support by our colleagues. In our focus countries, we have a team of experts based in the countries who are able to support smaller TA requests. We can also provide support through consultants who can come in as experts on specific programs or projects. And we can also offer financial support for projects, which will be smaller grants that are tied to specific outcomes. Next slide, please. Yes, thanks. I've included here a very brief overview of how to get in touch with us. We have a website where all relevant information and application documents can be found. I have included the link here. I've also included contact details for our technical advisors in case you would like to reach out to colleagues directly. You can see here only the contacts for the BMZ-funded countries yet. I will share an updated version. We are still we are recruiting new team members in the FCDO-funded countries. Once I have contact for those new team members, I'll make sure to share those with the network so that you can also reach out to colleagues in those countries. And on the website, you can find more information on Backup Pulse as a program, but also proposal forms, background information on eligibility criteria, and everything that you need to know in this regard. But then also sometimes I know it's quite cumbersome to go through all those documents. So please feel free to reach out to me or any of my colleagues in case you do have any questions, and we're happy to support in this regard as well. I think that was a very brief presentation from my end. Thanks a lot, Vivian.
Very brief and very impactful, because there's a lot of data. And ladies and gentlemen, I've seen one question recurring on the chats, and yes, we will share the presentations after this discussion, and also the link to the recording. So do not worry about that, or if you've skipped anything important that you might have missed. I will go to the next speaker, and you'll see that there's some sort of sequence, and we're trying to let you know who provides the TA. So we're going to go to overview of Lean Initiative technical support. I think there's a French accent I'm supposed to use there, which I do not have, but I'm calling out to Isabel. Yes, now Isabel, please help me out by just learning how to pronounce the Lean Initiative. There has to be something there, and also your last name, if you do not mind.
Yes, you were quite close. L'Initiative. So just that's exactly like that. And I'm Isabelle Autelar, so from France. So going to present today. I shared my screen. I hope you can see it, and it's fluid. Everything's working.
Yes.
Maybe I can just share it in the full screen. Okay.
Yes.
So just to present, I think maybe some of you already heard about us, but just in case, just to present, we're a facility that comes complementary to the Global Fund, the French set aside to the Global Fund that was created in 2011, and we provide technical assistance, but also fund catalytic projects to help support the Global Fund activity on HIV, TB, malaria, and health system strengthening. So this current cycle, we have 20% of the fund's contribution to the Global Fund. We have a very big increase in the budget compared to the previous cycles. So this is the countries we can, the eligible countries that we can work with. We have 40 countries, mainly in Western Central Africa, but we also have Southeast Asian countries and a few Francophone countries, but also countries that have high impact, considered high impact by the Global Fund. So just to explain how we work, we have 3 modalities. So we provide technical assistance, and this is what I'm going to present in detail today. But we also have the funding for catalytic projects. We have a yearly call for proposal on operational research, health system strengthening, and key vulnerable populations. And we also have a special modality that allows us to be more flexible to intervene on neglected challenges. Just a few information. So I will share the slide later on, so I will not be presenting this one, but you can click here that we have a key initiative data on the support we provided to NGOs between 2017 and 2022. So they can be a bit interesting to have data on what we have supported and what we can support. Just to present on the TA. So for us, the TA is minimum up to 12 months, maximum 12 months. We provide the TA to all the actors from the Global Fund ecosystem that needs specific needs. So it can be requested at any stage of the Global Fund funding cycle. It's a application process that's available on our website that explains everything on how to request. It's the idea is really to have the TA demand-based TA, so that the partners have to emit a request and express their needs, and then we can build together the TA request, and then provide this adequate support. We have a diverse pool of experts, and we also have different modalities of type of expertise. It can be someone long-term placed in the country, but it can also be how do you say, intermittent support, depending on the needs. We can provide support to all the different structures, so it can be CCMs, but also NGOs or the different beneficiaries. They can add a request for TA. This is a slide in French. I'm sorry, I did not translate it, but it's just on our website. You can find all this information on the different steps to request the TA. So we have online a link to download the letter for TA request, and then you have to submit it to the French embassy in the country. And then the French diplomatic network give a position, a review of the TA request and submit it to l'initiative. And then if we have the validation of our steering committee, we can approve the TA request, and then we can start with the TORs and provide the TA. This can be done all year round, and it's maximum 12 months for a TA request. So sometimes you have to have different phases of TA requests if you want to have a longer term TA. So this is also just coming back to the different process of how to request the TA. And as you can see, when we work, when the request is not approved, we can also discuss on how to respond to the steering committee needs and maybe come back with an informal request. So we can also try to save some of the TA requests that were not confirmed at the first try. We usually try to co-construct the TA request so that we can provide that support. Just to give a few data, we have on the over 70 beneficiaries, majority of them are local NGOs that are beneficiaries of our TA currently. And the 10 countries that have more of our TA are mainly Western Central Africa countries. Just another key data of the TA provided to NGOs. And for the expertise channel, well, that you can have for the projects channel, you can find all the details on our website. So I will not go too much into details on the funding cycle for the calls for proposals, but this is we have projects that benefit majority also, and a big part of the beneficiaries of the projects are local NGOs and community-based organizations. And we also have l'accélérateur, which is the modality I was presenting before. That's quite flexible. We have in this modality built a Sophia Fund to support mid-sized organizations. But the countries that are eligible are Benin, Burundi, Congo, Djibouti, Gabon, Guinea, Mauritania, Central Africa, DRC, Chad, and Togo. And in these countries, we provide tailored TA and small grants to select organization that responded to a call for manifestation of interest. The current call for manifestation of interest is already closed, and we are reviewing to select the organizations, but we will have a next phase next year, and from the eligible countries, they can still submit a call for manifestation of interest. And just as an information as well, we support a co-funding with Stop TB partnership for supporting the challenge facility for civil society. So if you don't know what it is, it's there's more information online, but it's something that we're expanding to Francophone African countries that were not really part of the scope of the challenge facility for civil society. So that's also something that we have provided as a support. And if you have further questions, well, we'll share the slides and we'll be happy to answer.
Great, perfect. And before you just hang up, there's a question that came in, which is pretty obvious. I know when you started, you mentioned this is the French equivalent of Global Fund. So the question is, do you provide TA for Anglophone and Lusophone speaking, or is this just for Francophone speaking countries in the African continent?
No, we also provide to non-francophone countries. The list is there. We have on the map. Some of the countries that are not only francophone, but on the list of eligible countries, it's been defined by the high impact countries and the francophone countries, and also Western and Central African countries. So we don't only have francophone in our beneficiaries.
Great. Thank you,
But just
Isabel.
the 40.
I know other questions will also come in. Sorry. And just stick around, because I know some other questions will also come in following that particular one. Ladies and gentlemen, we're going to go to the next presenter. I'm assuming, Isabel, that was your last slide, right?
Yes.
Yeah, perfect. Thank you very much.
you.
Appreciate it. So that was the initiative telling us how to get TA support from their end. And now we're going to go to have an overview of Stop TB Partnership's technical support. And I know we were waiting and looking forward for this also. James, are you around?
Yes, I am.
There you
Thanks so
are.
much.
Long time no see the face, yeah?
Yeah,
How are you?
look, we're waiting for good things.
Good.
So let me just
Over to
work
you,
out how to
James.
share this.
Okay, perfect.
So look, yes, while I work this out, it's so my name is James Marler. I work for the Stop TB Partnership in Geneva, and from the site, so we're also a technical assistance provider. In this presentation, I'm going to look entire screen. Does that work? Can you see my screen here with the presentation?
Yes,
Yeah,
there it
wonderful.
is.
Okay, sorry for that. So yes, we're also a technical assistance provider. I wanted to focus a little bit around some of the technical assistance that's available for some issues relating to communities' rights and gender, noting that this is certainly something that's, I think, of an area of interest for a lot of people on this call, but has also been an area where maybe there hasn't been as much uptake and investment as we really would have liked to have seen from the side of Stop TB in terms of when comparing to other TA levels of investment. So I note, like, one of the things that's, I think, interesting here for when we consider CRG in the context of TB is the TB response in many ways is looking at overcoming barriers and finding the missing people with TB to avoid, delayed diagnosis, to ensure people get on treatment when they need to. So it's these CRG related barriers which are part of the challenge and part of this barrier, which is impeding this goal, which is basically the heart of what's the aim of a global TB response. So when we're talking about a lot of this TA for CRG, I think it's of critical importance in the TB response, and it is an area that's maybe not really been tapped into as much as it can be, and therefore is a huge opportunity for countries, for ministries of health, for national TB programs, and for civil society and affected community organization groups to really look to take forward and to build into their work and to scale up in their work. So I note that this has been something that's really been prioritized by TB affected communities and civil society themselves. They've really looked for the scale up of these areas of work, for more investment in communities, into some of these areas of community rights and gender, and also the related access to technical assistance and technical assistance mechanisms in the context of TB to do this. Now, in terms of supporting this work, one of the pillars, I suppose, of this technical support that comes from Stop TB has been the development and piloting and supporting operationalizing a number of TB CRG related tools. And this includes one for community rights and gender assessments and costed action planning at country level. And I know many countries in the region have done this. This is very much about identifying what these barriers are, building the evidence base and coming up with solutions and costings to overcome them. Second is an area called the stigma measurement assessment, and a lot of people are familiar with the HIV stigma index. There is also a stigma assessment for TB. And what's significant about this is it's also the three key indicators here looking at stigma are also part of the Global Fund Performance Framework. So the areas where monitoring of grant progress is being looked at. So that's, I guess, a big hook for you at country level to be able to do some work in terms of TB stigma and the tool to be able to implement this. Again, this is also linked to the first part around how do we then use the findings and recommendations to have costed interventions to overcome the challenges that are there. A third tool and area is looking at community-led monitoring for TB. Again, we know that there's been, initiatives for HIV community-led monitoring for many years, but I think that the entry point, the focus for TB community-led monitoring is something that's been quite different. It's very much around access to quality services, which, although is relevant across other CLM responses, it's a unique entry point given that the majority of TB services are government provided, which is maybe distinct from other health responses. So this approach to community-led monitoring for TB, the One Impact approach, is being now piloted and is adapted and is operational in over 30 countries globally. Many countries in the African region. There's over 200,000 active users and engagers in this model. So again, there is something here, I think, where around the technical support that's available, which is really interesting to look to take forward. And one final one I wanted to talk to is the TB key and vulnerable population size estimation tool. One of the things that we found here in an area where we see of importance for technical support in TB is understanding what the experience is for TB key and vulnerable populations. A lot of TB responses still have a largely general population kind of focus, but we understand that certain groups face disproportionate barriers and challenges in accessing services that they may have and as a result of this require enhanced focus, enhanced attention, their engagement and leadership and investment. So this is something as well where we see as an important area of technical support for a TB response, which we think is something that can be taken forward in many countries in the region. I know that this tool is also now currently being utilized in several countries in the region, has been already completed in Nigeria. And one of the things that was particularly interesting here was the focus looking at nomadic and tribal populations in Nigeria. And the findings were that a lot of the data, a lot of the numbers at country level that were being used were incorrect by millions. In terms of nomadic and tribal populations, the implications are the level of services and the level of investment that's going to these populations was needs to be revisited. And this is something that I think can have a really significant impact, not just on the TB response and how we think about it, but also broader access to health outcomes for a lot of marginalized, vulnerable populations as well. As I mentioned, I just wanted to note that the approach for TB community-led monitoring, the One Impact approach, you can see a link on this particular slide where you can see a little bit more. Many of your countries already are going through the process of using this, but other countries, I would encourage you to see if this is something where you'd be interested in sort of taking this forward to maybe complement other existing CLM initiatives at the country level. As I mentioned, there is this stigma assessment tool, the 3 indicators looking at stigma of the self, stigma in communities, and stigma in healthcare settings are the 3 indicators from Global Fund's performance framework. And it is something that we really want to see taken forward. Now, one of the things here I just wanted to add for you all is a little bit of a package, a support package, I guess, for communities around CRG for Global Fund, the Grant Cycle 7. And you can see here in the link a number of the tools that I've spoken about, how you can sort of cost them, include them, use them as evidence as part of your Global Fund work. So I just use this as I think it is an important resource that can support you in the work you're doing. Now, following on from, I guess, the L'initiative presentation, it's wonderful to have L'initiative as one of the champions and supporters of the Stop TB Challenge Facility for Civil Society. It was previously also supported by Global Fund, and the current round, L'initiative, is together with USAID. It's the largest round to date with over $13 million of investment. There's over 40 grantees globally. And this, in terms of the African region, includes a couple of Francophone Africa as well as Mozambique from Lusophone Africa. But you can also see on the screen here, like the countries where we do have several active grants. obviously Benin, Burkina Faso, Cameroon, Central African Republic, Cote d'Ivoire, DRC, Ethiopia, Ghana, Kenya, Malawi, Mozambique, Nigeria, Sierra Leone, South Africa, Tanzania, Uganda, Zambia, and Zimbabwe, who are also complemented, I suppose, with 3 regional level grants, including our friends here at IANASO, but also the African Coalition on TB, who is based in Ghana, and Lawyers Alert, who's based in Nigeria. So just to say that there are these, like a number of grantees in each of these countries who are working to take forward different CRG priorities at country level. And significantly, I suppose that the Challenge Facility for Civil Society is our mechanism for delivering TA through communities, through civil society at the country level. It's a principle that we think is critically important for a TB response. So having all of these grantees leading this work, building partnerships at the country level has been something that's been really, really effective. One thing that's been, is important to note here, I think when we're delivering TA around the context of TB, we know, all of us who work in TB, that to progress any of these initiatives, to ensure sustainability, you have to take the National TB Program and the Ministry of Health with you. They're the main deliverer of services. They're the sort of the holders, I guess, of the whole TB response. And through this TA and through these grantees, we've seen those partnerships with civil society and affected communities increase, and an increased focus on CRG as a result. So just to note, I think that this is something as to why a lot of this TA is going through this mechanism and has also had some of that effect to really take forward a lot of this work. For many of you to be aware, the next round for Challenge Facility, our call for proposals is expected before the end of the year. So this is something where I think that there's still further opportunities, and maybe some of you who are only finding out about this mechanism now might be interested to look at, to see if there's areas which you might want to sort of take forward as well. Now, I think the final thing here is to note, obviously I focused a lot on these CRG related, the tools, the mechanism, the small grants and the support that goes out. But from the side of Stop TB is the UN hosted partnership to end TB. So we're not just focusing on the CRG side. There's sort of we also provide technical assistance around funding request development and around the technical implementation of grants at the country level. So just to be aware that you can reach out to Stop TB also for that sort of support, which we prioritize in USAID and l'Initiative Expertise France priority countries just in particular, but there are sometimes opportunities in additional countries as well. I guess the final thing I'll just note, I made this point already, but one of the things in terms of accessing this sort of TA, obviously through the grants, it's very clear, but some of the additional TA, we do sort of look to work and facilitate and encourage a sort of a joint partnership approach between civil society, affected communities, and your national TB program to reach out and request this TA, noting that partnership is so crucial to taking all of this work forward. But I might just say thank you for the opportunity to IANASO and the Learning Hub for the opportunity to engage and to share some of these perspectives and inputs around from the TB side around technical assistance. Back to you, Lizzie.
Thank you, James. It's always a pleasure having you and the rest of the team just, giving more insight on what you're doing as Stop TB. I know there was a question that came in about linking up, and of course, yes, Magaji, we will share all this data on how you can connect with any of the speakers that spoke, and maybe you wanted a follow-up on that. But IANASO is also here to help with all your TA needs. So once you have any question that might not be answered while we're on this call, please feel free to reach out to IANASO. And of course, how do you reach out to IANASO, and how does the Anglophone Learning Hub work, and how does the TA aspect come in as one of our forte as IANASO? So that's why we have the next speaker, Glory, who's going to take us through that particular aspect. I saw Glory here. Glory, there you are. Perfect. So Glory, over to you just to let us know more about IANASO, TA support, etc. Over to you. Oh, yes. And before you start and share your screen, I like, this is why I like working with CSOs and community groups. You guys are always like trying to challenge the norms and making things disruptive and using technology. And I appreciate that. And we're going to have just 20 minutes later on with Mentimeter. But before Glory, you share your screen, I'm just going to share mine real quick so that we can get the code up and running. So ladies and gentlemen, This is what we're going to do. We're going to do a quick round just to give you the details on, sorry, I was showing off my technical proness and now it's disappointing me. Let me just present that and share my screen. Great. So we'll have a session later on, and the session will be pretty interesting just to see what your thoughts are, and also you can type your questions. But in the meantime, just if you can see my screen, it's all about technical assistance, but we're going to do a bit of Menti questions later on. So you can go to your screen and type www.menti.com, or you can take your mobile and just scan the QR code, and it will take you directly to the Menti session that we're going to have. This is just a snippet. Of course, once you're there, you can send a thumbs up so that I know you've gotten to the beat. But just type www.menti.com. I've seen 3 people, 4 people. That's good. And the code is there. It's 844-01805, which I've also typed on the chat. Looking forward to having this technical, interaction later on. But I'll stop there. Glory, over to you.
Yeah, thank you so much, Liz. Yeah, thank you so much, Liz. My name is Glory Chagama, and I do coordinate the Anglophone Regional Learning Hub activities at IANASO. I'm not going to say much about who IANASO is because my colleague Rodrigue has already mentioned that. I'll just go straight forward to the role of Learning Hub. So, Learning Hub is a vibrant space to facilitate peer exchange and learnings, capacity building, and collaboration to strengthen the engagement and leadership of communities most affected by HIV, tuberculosis, and malaria in Global Fund and related processes. So what do? We identify learning needs by conducting surveys to pinpoint learning needs among communities for better engagement. And thank you so much. I know we shared the survey in the past few months, and we have received your recommendations in the areas where you need support, where you need more learnings, where you need TA support. And we are in the final stage on finalizing the assessment report, and we will share with you so that you can see what other colleagues have responded. We also share updates, and this we do through our webinars, newsletters, and social media's platform. And what we want to make sure that civil society and communities are not left behind in terms of any information, any listed information that is available. We want communities and civil society to get that information on time. We also foster learning through we unite community representative, technical partners, and stakeholders to exchange insight via webinars, meetings, and scientific events. Just like this session that we had today, we have managed to invite technical providers, technical support providers who have shared the information on the opportunities that civil society and communities can tap on. We also support you to access technical assistance, as I mentioned. And here is we aid communities in accessing technical assistance from the Global Fund and other technical support mechanism by sharing TA opportunities and facilitating and supporting the application processes. So as Niluka mentioned that, the technical support, the Global Fund technical support, the Community Engagement Strategic Initiative technical support, IANASO, we support you through reviewing your application before submitting it to the Global Fund. So our role is to make sure that you get the necessary information about the technical support. We review your TA. If it needs any amendment, if we need to be refined, we take you through together until we are all happy that now you can submit to the Global Fund. And after that, as Niluka said, we also do the case studies, like the assessment to see how do you find the TA. We also like feedback, even Global Fund like feedback on how the experience have been during the entire period of requesting the TA up to the implementation, so that in case there are any recommendations, in case there are any gaps, and even there are good things that you want to us and the Global Fund to proceed, then we get that through. We also do rapid engagement support. We provide in-country community engagement support through small grants. We have small budget for small grants for specific in-country support. Reach out to us if you feel like you have a burning activity at your country and you wish to engage and you don't have any support. Reach out to us so that we can see if it's something that we can support. We highlight success stories. So we really love to hear case studies to spotlight effective community engagement practices, lessons learned from countries. We know that as a region, each and everyone, civil society and communities, you are doing a lot of work in the ground. IANASO is happy to showcase your activities so that other countries also can learn from you. Next slide, please. So how can you engage with the Anglophone Africa Regional Learning Hub? Please connect to us. You can subscribe to our newsletter. Liz will share the link. You can follow our social media accounts. All of our social media accounts start with IANASO. So if you type on Facebook IANASO, on X Space, on Instagram, you'll find there. You can engage with us. You can seek TA for community engagement to engage in country and the Global Fund processes. You can refer to the presentation that Niluka shared on the 4 areas that Global Fund support and can provide TA on the assessment, needs assessment, the NSP reviews, grant implementation. So engage with us if you feel like you need TA support on that areas. We are here to support. You can also contribute to our work. You can propose any regional relevant inputs and best practices to the Learning Hub to feature on its work. So if you want us to share the work that you are doing, an impactful work that you are doing in your country or at a regional level, just share with us so that we can also share with other communities and civil society so that they can understand or they can join hands on doing what other colleagues are doing. Participate in our events. We usually hold virtual events and in-person learning events. Of course, we cannot invite all of you in-person events, but we believe that through our virtual learnings, you can join us, and we are happy to be with you, to learn more with you, and to engage more with you. Next slide, please. Just to say thank you so much for you listening and for joining this session. Thank you so much, Liz. Over to you.
Great, thank you, Glory. And I think now it's evident Lizzie and Glory, they're 2 different people. So that is good to know. But we're opening the discussions now for Q&A, and this is where I get super excited. I've seen a lot of questions come in, but I'm going to call you back, Niluka, because there's one that was a bit mind-boggling. But ladies and gentlemen, how we started off was we were looking at understanding available technical support, and we spoke with the Global Fund, Niluka, Caroline, Chacho also from UNAIDS, and then we got Katrine from GIZ Backup Health, then Isabel from Lee Initiative, and then we stopped with James from Stop TB. Now, quick question, Niluka, in regards to applying for TA support, can I use one TA and just copy paste it across all these other organizations? Is that feasible?
You mean use the same TA application across?
Yeah. And that's because you know very well during the presentation it was quite evident that funding, especially for the 3 diseases, has dwindled. So it's just a matter of trying to see whether you can dip your hands in all the pots that are available.
I think we need to take it it's not as easy as that is. I think so. What we also want to do, and at the global level, TA providers have a TA coordination mechanism. So we are talking at the global level, what kind of TA is supported by which TA mechanism, especially to not replicate and also duplicate the efforts. For instance, if Global Fund CESI, the Community Engagement Strategic Initiative, can support around, so sorry, let me start this way. So CESI, we are very clear of what we can support. It's around situation analysis or needs assessments. It's around funding request, the country dialogue, and preparing community priorities for a country dialogue. And then around implementation support. How do we build up community capacity around global fund processes and issues so they can be better engaged. And then we are very clear that we can't provide organizational development support. And I think that's where other TA mechanisms come in. We can't support funding request development or funding request writing. That's where UNAIDS, TSM, and other TA providers come in. So as communities, I think we also have to be very strategic. Short-term TA, very quick, 3 months, we can deliver it. But if you need like longer-term TA, then we have UNAIDS, we have expertise fronts. So it's not a matter of, getting the same TA application, and just putting it to every TA mechanism, but making sure that we go in and see what are each TA mechanism priorities, and then really pitch it to that. So I think that's where Learning Hub comes into play, because you play a main role in supporting communities to identify which mechanism would be very suitable to a particular TA request. So you like, for instance, if you get the Anglophone Learning Hub, you have already supported 9 TA applications for the first 6 months of this cycle. And some of them are to our community engagement strategic initiatives, but you have also supported communities to access other TA mechanisms. I think that's the role we also need to appreciate and use as much as possible.
I hear you. And I like the fact that also James kind of concurs with your comments, and he says, the TA providers have also a system of how they're working together. So there's no that overlap or some TA just being used anyhowly. But together, so he says it is good to know that a lot of the TA providers work together to coordinate as well, which is very good. I saw a question, and I think where was that question again? So ladies and gentlemen, we've opened, maybe I need to take it a step back. We've opened up the floor for Q&A, and this is the part where we want to hear from you. So use your electronic hand, or you can even type your question, but it's usually very interesting if you just unmute yourself and have your video on or something. So Sophia, if you're there, I've seen a question from your end, Sophia Mohammed. I don't know whether you're there, you'd want to ask it directly, or if you'd like to let us know exactly who you want this question directed to. Yes, Kenneth, we will share the recording later on. But Sophia is asking, is it possible to support direct NGOs? Sophia, I'm not too sure what that means, but if you're okay, you can feel free to just unmute yourself. And this goes back to Glory. So there's a question about ENASO. Do you support other diseases rather than malaria, TB, and HIV? I know that's usually a question that comes up every now and then. And I think when we're talking about rapid engagement support, CIE, feel free to actually just use your electronic hand and re-ask this question, which wasn't that clear. But Glory, over to you in terms of which other diseases does ENASO work around. But ladies and gentlemen, I've also seen a lot of TA consultants on the call, and I'm hoping they'll also want to chime in and just say a few things in terms of their experience. I've seen Rhoda, I've seen Lewa there, so looking forward to also having them just give in a few of their comments. So Glory, over to you.
Yeah, thank you so much, Liz. Wouldn't say that we are only working on HIV, TB, and malaria. Rather, we broadly work on public health related matters. So it's beyond HIV, TB, and malaria. We are tackling issues on sexual reproductive health and rights, gender-based violence, gender inequality, climate crisis issues. Now we see there are a lot of climate climate change matters. We also work on issues on pandemic preparedness, One Health. So yeah, we are not only on HIV, TB, and malaria, and our scope is beyond that. Thank you.
Great, thank you, Glory. Yes. So there is a question that's directed to the initiative, and they're asking how can they reach out to you, Isabel?
Yes, so to reach out to us, maybe from our website, there's the links on, if you want to request TA, it's the diplomatic, the diplomatic post of the country, the French embassy in the country, that has to be contacted. So we have on our website the lists of all the diplomatic representations in the countries that are eligible to l'initiative, and through that you can contact them. Otherwise, you can also reach out to maybe ENASO or me if you want to have more information. But our website also have completed. I think they have a contacts specified in the website.
Perfect, and thank you very much. I've also seen Luca just taking some of the questions. I saw Sunday Godwin's up. Yes, Simon, I was going to look for you because I didn't understand who to direct your question to. But Simon, over to you. And in the meantime, when Simon is coming on board to ask his question, we're still just going to do a bit of a resharing of the Mentimeter that's ongoing. Ideally, that's the code. But Simon, over to you so that you can feel free to ask your question.
Thank you so much. Mine is not a direct question, but it's a token of appreciation for unpacking some of these technical issues like RSS. Uganda, we are one of the beneficiaries of Global Fund. And for me, I work with vulnerable population, the fishing community, which is a big population in Uganda, with over 12.5 million people in the 5 Great Lakes of Uganda. So I have really understood very well how we can align our activities for RSS, where you mentioned the community engagement, coordination, dialogues, community-led monitoring activities, and we look forward our systems to be strengthened with this activity. And I participated also in the grant writing of Global Fund in Uganda here, and really I'm very excited to see this program you have initiated to unpack some of these technical issues.
Great, perfect.
Back to you.
Great, thank you. And I think this is something that we take pride in, and it's usually very good if you hear somebody say, we've understood the process, we've used it before, it works. This is some of the moments you feel good about what we do as the ENASO, and I'm pretty sure also the TA providers on the call. I've seen Rhoda Lewa, and I was looking forward to you speaking. So Rhoda, over to you.
Thank you so much, Lizzie, and yeah, it's great engaging with all of you around the globe. Indeed, thank you, ENASO and the technical and funding partners for continued support over the years. I'm an independent consultant based in Nairobi, Kenya.
Just 1 minute, Rhoda, just 1 minute. Sorry to interrupt you. Richard, I know there's somebody called Cleophas. I'm trying to mute him. It's not happening. Do you mind muting Cleophas? Sorry about that, Rhoda. Over to you. Sorry.
Thank you. Yeah, mine is an comment/question to both ENASO and the funding and technical partners who presented today very well. We see a peak of TA requests around funding request development, and a lot of the requests normally come from civil society as well as CCMs. A significant number of countries have dual track financing with civil society PRs. But in the course of grant implementation, irrespective of the number of grant implementation challenges faced, we don't see TA as stemming from either the CCM/Oversight Committee, and we don't see demand that is coming from PRs. And it's from where I sit as a beneficiary of services and also a consultant, it's very challenging to see that there are some things that we could have solved in the course of grant implementation right through grant closure, but they remain unattended to right through the funding cycle until we get into another funding request development phase. So it's just for us to look for those, how can we look, whether it's in ASO or TA providers, how can we think out of the box so that that peak that we see during funding request development doesn't mellow to like zero, but it plateaus progressively, rather than just dropping down and then remaining at near zero. Thank you.
Thank you. And I'm going to direct that back to James and UNAIDS, and because I've seen that and it's quite evident. Usually there's the hike and then it goes down and we wait for the next cycle, then it goes up. And yeah, so I'll start with James on that question, James, and then go to Caroline on that. James, over to you.
Just to confirm, Lizzie, so it's to say that there's, I guess, at the start of each cycle, we have this enthusiasm and then it drifts away. Look, I tend to agree, but I'd say I'd even add more to it, that from the side of TB, the hype that we see doesn't translate into investment into TA very often at any point in the cycle, even at the start, even when we are enthusiastic. So I think that that's something for us to all take on board, and hopefully it's a takeaway here from the side of ENASO in this capacity to think a little bit about how can we specifically ensure that we're getting some successful applications in for TA right from the beginning. The second point, I think there is a need for this to be something that is consistent from the side of Stop TB, and I think from some of the other TA providers as well, but they would be better placed to answer. Like, that our support is not limited to just the start of the cycle. It can continue throughout. So it is something that I think is more about how do we ensure that we maintain our focus and our recollection that this is something that is available to us. So I think that that's something that's maybe on all of us to continue to remind and to connect with different partners to let them know that this is an opportunity that's still there. And the third and final point is I talked a little bit to the Challenge Facility for Civil Society. It is a key way in which Stop TB delivers technical support to country partners and through country partners. And that's something which is generally an opportunity on an annual basis as well. So it is something which is not just limited to the start of those grant cycles, and maybe is something which partners could look to leverage going forward. Thanks, Lily.
Great, I hear you, and that's true. So over to you, Caroline. What are your inputs? What are your thoughts on that?
Okay, thank you very much for the question. As I said in my presentation, the entry point for all the requests are in the countries. So civil society should liaise with our country offices to receive the TAs. They should really do that. It's true that during the Global Fund request, we have a lot of requests from the countries, and for the grant implementation, we have nothing, we receive nothing. So it would be good for the CSOs to contact our country offices if they want to request some TA from the country office, and then we will fund that.
Great. And I know we have a very interesting speaker, Aaron Sunday. And I know I saw Aaron also take some of the questions. Thank you very much, Aaron, for doing that on the chat. So we're going to get to Aaron, where he's going to talk about community experience, so best practices that contributed to improved TA outcome using TA deliverables. And ladies and gentlemen, the Q&A is not over. We're still going to take these questions, and I've seen most of the speakers also just address this directly on the chats. So Aaron, are you there? Just double checking if we lost Aaron or Aaron is still in the call.
Hello, can you hear me?
Yes, there you are. Hi, Aaron. How are you?
Fine. Good afternoon, everybody.
Good afternoon. So over to you.
Very quickly, I would say it depends on the needs. From our own experience, oftentimes we apply TA to see how young people will engage in the entire funding request development process, grant making, and even the sign off that the country CCM usually do. So, but that is not just being done without due consultation and engagement of experts who do the deck review and key informant interview to annex other informations. And as well, we go to different states in Nigeria across the 6 regions to engage with diverse adolescents and young people who now tell us their priorities within HIV prevention, treatment, and also RSSH and also malaria. And that priorities, together with them, we frame it and develop it into a concrete intervention or activities. And then that inform an engagement plan that we follow through the process. And we support some young people to participate in the grant proposal writing itself, where they are also contributing directly with the technical team writing the proposal for the country and developing budget as well. And over time, I will say the model has worked before. If you look at the first year we got was in 2020. That was the first time Nigeria was having a massive young people engaging in the process. And that yielded around $3 million that was allocated for AGYW. Now, if you fast forward to the last 7 process, we also engaged in the process, and about $13 million is allocated. And now we have, for the first time, youth organization directly implementing Anglophone grant, not having just SR doing the work, but funding is going directly to the youth organization. But that was not possible without that consultation and also developing that framework that guides every aspect of what is support supposed to do. Even COVID response mechanism, Anglophone also came through to ensure we had some TA, and that also informed priorities of young people within COVID. And that also goes into what the country supported, and as well the implementation process, we are also engaged. Lastly, you know, Nigeria over time have been working around TB, but you can't really bring out what is the role of youth within TB response in the country. ANID also approached Anglophone, and we have a TA now approved. For the first time, again, we want to see how to drive that process where we can engage with young people with TB, those within the slum, migrants and the refugees, and see how do we also come up with a parity that will inform existing Anglophone GC7 grant in the country, and also other things that I think the country needs to also start doing in addressing TB for young people. Thank you.
Well, thank you very much, Aaron. And it's clear that it's working. And I like what was said during the initial discussions, and the role of INASO is just to proofread what you're about to send, so that when you send it, chances of actually getting it are high. It's like a cheat sheet, so to speak. So this is a good thing. I've seen a hand from Simon Mashwari. And ladies and gentlemen, if you have any questions or any experience you'd want to share, maybe it's not as rosy as Aaron's experience. It could be like a little bit of challenges you've been facing. We're still open for Q&A. As I mentioned, the Q&A bit is where we need to make sure that your questions are answered. And we're going to do this incorporating technology, but also having you ask your questions. So we'll start off with Simon, and then we'll go back to Aniobi. So Simon, over to you. But in the meantime, I'll share my screen. Let's get the and INASO team, if you can help me with muting the rest, that would be awesome. Thank you. So in the meantime, Simon, before you start off, I'm just going to go back to the Mentimeter also. And I've seen a lot of countries in the house. So Simon, over to
Are
you.
you
You can
hearing
just
me?
unmute. Yes, we can hear you. Over to you.
Are you hear me? Hello?
Yes, we can hear you. Just proceed.
Oh,
Are you having a technical glitch, Simon? But I can hear you.
all right. Hello. Hi.
Hello.
Girl, how are you always?
All good.
My name is Simon Mashauri. I'm CEO, Chief Executive Director of Tiba Salama Digital Health App. That's based in Tanzania. Actually, I would like to ask a question about this support from the social enterprises company. Is it eligible to apply or just only NGO? Thank you. That is my question. Because Tiba Salama Digital Health App, we are just dealing with the referral and healthcare education for pregnant mothers and newborns in Tanzania. So through technology and through CHW in Tanzania. So that's my question, please. It would be great to hear from your side.
Perfect.
Thank you.
Thank you, Simon. And we'll take another question, but I think I'll redirect that question to Isabel in terms of who is eligible for your TAs. So we'll go to the next hand that was up. Anyobi, just feel free to unmute and ask your question. In the meantime, ladies and gentlemen, the Menti one is very straightforward. You have two options. You can either scan this QR code that's on the screen, or alternatively, which is much more easier, just click www.menti.com. When it asks you for a code, it's 84401805. And the good thing is this code is still being displayed everywhere. And we've seen that a lot of people who've come in from different countries. So as the next question is being addressed, we'd also want to hear from you. What are some of the challenges you face while accessing TA? I know a lot of people might not have the opportunity to unmute, but feel free to just type your questions. Yes, so over to you, Anyobi. You can ask your question. I'm assuming we have Anyobi on the call. Your hand is still up. Anyobi Paul, feel free to just ask your question. Okay, no worries. So ladies and gentlemen, we started off with over 80 participants, but we have 60 on the call, and we'd like to hear from you on some of the challenges. We've heard from Aaron, some of the experiences, and looks like most of them are all very, good experience, positive experience, but we'd also want to hear from you if you've had any experience with TA and what were the challenges you're facing. Just use the code 84011805. Type www.menti.com, and we should be able to start seeing your live responses. Great. And we'll be taking into account some of these challenges, but let's go back to having the first question from Simon being responded to. Now, quick question. Is it Simon Masharu who had his hand up first, or is it Simon Ayebale? Then the other Simon, if you don't mind, just unmute yourself and ask your question.
Simon Ayebale.
Great. Over to you.
Okay. Once again, I wanted to get clarity because in some countries we have some gaps of funding to support our technical assistance issues, where we could have for us as a national network of civil society to digest on very key issues, like we are now in the new funding model. Some of our civil society members, the vulnerable groups and the key populations are not well brought on board, and we sometimes need to engage the stakeholders like CCM, like the principal recipient of the grant, but we don't have that capacity. How best can we be supported to have some bit of engagement to ensure that our issues are well addressed? I need your technical guidance there. Thank you.
Perfect. And just Simon, before you hang up, would you want to direct this question to any particular TA provider, or do you want this to be answered by any of the speakers?
Well, I didn't mark the name well.
Okay. So we have
The
Global
first part,
Fund, Lee Initiative, GIZ, UNAIDS, Stop TB in the room. I don't know whether you wanted one particular person to address that question. But no worries. I think we'll open it up for any of the speakers to respond to it.
yeah, UNAIDS will be okay because UNAIDS usually support comprehensively. When I look at our UNAIDS support here, I think it has a wider scope. And when we have a gap in such a situation, we can go for rescue maybe to ensure that we get support. Thank you.
Okay, great. So I think we'll hand it over to Caroline Chacho on addressing that particular question from Simon. If Caroline, you're still on the call.
Yes, I'm still here. Yes, what can I say? The way the GSM is organized, we always ask the CCM, PR, SSR or SR to liaise with our country offices to request for the request of the TAs. So they should liaise with the CCM and they will liaise with our country offices to get get the support to have the request to have the to receive support from us. I think that's what I can say.
Okay, great. And then I'll call out to Katrine and Isabel. There was a question being addressed, and it was all about, is TA that you're providing available to NGOs or CSOs, or is this broader to anybody else to apply for? So I think we'll start with Katrine and then we go to Isabel. Katrine, are you there? Isabel, maybe we start with you because I can't get hold of Katrine.
Yes, so I put on the chat the list of the beneficiaries for technical assistance. We provide technical assistance to CCMs, but to other structures, not only NGOs or CBOs, but we do like to have requests from CBOs. It's something that we are looking into. We have a steering committee that has to give validation to all the engagement commitments we have. And they are particularly keen on having support to CSOs and NGOs, CBOs, sorry, because that's something that we think this need to be strengthened, and we are happy to provide the TA. But as was recalled on the chat, we are only active in 40 eligible countries, and some of the participants here are not in eligible countries. So the only way you can benefit for TA is if you go through a regional request with one of the beneficiary countries, for example, Mozambique or Rwanda. Otherwise, we are quite limited to need to be part of the 40 eligible countries. But
Yeah,
still, yeah, CSOs are definitely eligible.
Perfect, thank you. And I'd want to bring in Stop TB and Luca on this. And usually there's been a bit of concern about youth-led organization always being left behind. I mean, they're trying to catch up, but usually it's a process. And one of the challenges that has been put down is that there's that process that is long to get, especially among youth-led organization. What are your inputs around TA and youth-led organizations? We'll start with Niluka and then finish off with James.
Definitely. I think there's within the CSICA, the short-term TA of the Global Fund, there is a lot of space for youth-led networks and organizations to apply TA. Now, for instance, in this cycle, in the first 6 months, one of the TAs that we have supported, forgive me, I've forgotten the country, but is around engagement of adolescents and young people in global fund processes. So there's definitely that room, and we would really encourage organizations to support youth-led organizations to apply for TA through, especially around strengthening their engagement in global fund and related processes. We can work around situation analysis and needs assessments. We can look around strengthening their capacity around global fund issues, community rights and gender issues related to global fund. In terms of implementation arrangements, looking at how can young people contribute to decision making at the CCM levels, how do we create that bidirectional communication between young key populations, so young people who are affected by TB and malaria, and the decision making bodies around global fund decision making at the country level. So there's definitely the room. I think, Lizzie, what we need to be doing is also how do we raise awareness among youth-led organizations on the TA available. And most of the time, TA applications are available in number of languages and could be applied in number of languages. But young people would still need support to align their objectives and see how they align with country priorities and country grants. So this is the support that definitely, from the Global Fund side, the Learning Hub is providing, and in the Francophone Africa region, we have Rame, who's providing it. And if you come to, for instance, Rame or UNASO, they would also be able to direct you to Stop TB or to L'Initiative or to GC7, depending on your requirement. So please encourage youth networks and organizations in your countries to apply. Go and look at some of these websites and talk to the learning hubs or to any other organization that can provide them the support. But there's definitely the opportunity to apply.
Perfect, thank you. And James, while you're addressing that issue of youth-led organizations always being left behind, there is a bit of concern that I've seen with the answers coming in, that TA processes is quite lengthy, and somebody say TA is quite expensive. Maybe you can also address that while you're giving your input.
Well, the good questions. I think again for TB, we've seen this to be the case, a limited amount of focus on sort of youth engagement, youth participation. One of the global level challenge facility grants this year is with the Global Coalition of TB Advocates, and they're currently working to set up several national level youth networks for TB advocacy. And also a global network for TB advocacy that will actually be launched at the Union Conference in November. From the Challenge Facility grantee side, we've also had a couple of grantees who are working specifically on looking at the area of youth engagement, and there's been one really good example in Zimbabwe, for example, as one, but certainly an area that there needs to be much more on. In terms of just the process time, for us, it's fairly quick. The systems that we have in terms of consultants, we have rosters of people who are already identified, which can be deployed rapidly. Basically, we just need there to be some sort of agreement between civil society partners and the national TB program to make a specific request. We can still do TA if we know in some context that agreement can be difficult, and we can work around that. But just for the experience and the need for sustainability, it has been an approach that's worked best. So for us, it can happen rapidly in a matter of like days, to be able to put that into place. The fact that we also have so many grantees in these countries who are basically have the grant mechanism in place to support technical support, they also means that there is an opportunity for, obviously depending on what the particular request is, but we really do try to make it as fast as possible. Hopefully that helps, Lizzie. Thanks.
Yeah, I hope so. I hope that has actually kind of touched on the questions that were being addressed. But quick one. So ladies and gentlemen, we have 58 people on the call still. We're doing a Menti so that we can capture all your inputs. And you can just click www.menti.com and use the code 8401805. I've seen 4 responses coming in, and we're asking, are there any recommendations on what can be done to make TA access easier? And I'm going to call you back, Isabel. So there's a remark here of making the information user-friendly, and I'd like Gloria also to touch on this. how do you do it? Because we've seen that one of the challenges was it's too lengthy a process or it's too technical. And now our recommendation is make it user-friendly. So Isabel and Glory, what would be your input while addressing this one?
Well,
Yeah, Glory, okay, you can start off.
yeah, thank you, Liz. I think our role as Learning Hub is to make sure that the information that is given to the civil society and communities is simple and easy to understand. So, as I mentioned, as a Learning Hub so we are here to support you. If you feel like you don't understand anything about TA, please reach out to us. When you visit our website, you can find the contact. Please reach out to us. We will be more than happy to help you through. And we can even schedule one-on-one calls. That is our role. So feel free to reach out to us. And just to mention that we are at the moment, we are updating some of the information about TA on our website. So in 2 weeks to come, you'll find very good information about the TA, including the entire processes, the TA providers, and we can even share, refer you to the links of other TA providers where you can get more information about the TA. But feel free to reach out. Feel free to ask any question or anything that you feel like you don't understand. We are here to help you. And the question that it's a length process. Of course, I cannot say it is that much length, because what you are supposed to do is to do your application. You just need to understand what you want, or you just need to identify the TA need, then share with us, then we can direct you to the appropriate technical provider, and they review if you are TA is qualified, then it's usually get through. It is not that much length, just to assure you that it is not that much length as you think.
Okay.
But just
I hear you reach out to ENAS. So maybe you can also just type who at ENAS so they're supposed to reach out. Maybe put that on the chat. Isabel, if you're still there, so there is a claim that the information is too technical and too lengthy. Make it user friendly. Is that something that Lee Initiative has done?
I think yes, maybe on our website we had this effort of simplifying the process, and especially on all the steps to access TA. So I put on the chat a link that says that where you can download the form. It's a 3 pages form for submitting request for TA, and it's basically expressing the needs for TA or the issue that requests support, and then it's really a discussion with the French embassy in the country, and then it can be co-constructed. So access to TA is something that has been made more user-friendly compared to the initial phases. And our projects are also accessible on our website, and I think it's something that we're working on. Every time we have a field mission for our country teams that go, they try to present themselves to CSOs and explain how to access TA. And we also have this participation to meetings like this one. We also had with the RAME one in the Francophone Africa with the Learning Hub, Francophone African Learning Hub, trying to explain and share the information. So it's something that we are working on to make it more accessible.
Perfect. And I've seen Luca's hand up, and Luca, while you're coming in, which I also wanted to call Caroline to touch on this. So there is a remark where TA providers should make themselves available through national networks. And I needed to know how UNAIDS and Global Fund is actually working on that. So over to you, Niluka, and then we'll get to Caroline. But I'm not so sure whether Katrine is still on the call or she dropped off. Over to you, Niluka.
Great. In terms of the timing, as Glory mentioned, the short-term TA at the Global Fund, we've provided some clarification around the number of like 3 months that we need to mobilize the TA, because it requires looking for TA providers. But as Glory said, once we get an application and if the applicant has worked with the Learning Hub, and that is one of our strategies to make sure that the application is good and ready and will be eligible, so we can quickly go through the procurement process and mobilize the TA providers. But one of the something that we want to highlight always is if you send a TA application today and expect a workshop to be conducted in 2 weeks' time, that is not really possible because we need time to procure and procure the TA providers. So something that we could do is, as communities, we can always look ahead in terms of what's coming in. For instance, if the TRP recommendations are to come, then from now on, we can start working around a TA application, identifying the objectives. If we know, and through CCMs, we can know when the grant implementation is happening, we can look at what kind of grant implementation arrangements that we might want to work around. So it's always good to look ahead and identify opportunities.
Yeah.
The application process is very simple. The application is available online. In terms of national networks, I think one of our ways of working is through the Learning Hub. Let me stop there.
Okay, great. Caroline, if you're still on the call.
Okay. What was your question? Sorry.
Also, there is a concern about the TA process being very lengthy. The information needs to be user-friendly, but you also need to work with national networks and CCM in country. So I just needed your feedback on those 3 areas.
As I don't really know how it works at country level, but we always ask our UCOs to liaise to give the information about ESM to the national partners who are in need of technical support.
Okay, great. And I think I ignored this or I didn't highlight it. And any of you can actually take it up. TA is expensive. I saw this comment. I think I highlighted it, or maybe I ignored it intentionally, but it's here again. TA is expensive, and that is one of the topics that ENASO needs to cover. So is that the case, James? Is TA expensive? Is that the case when we're talking about that in terms of the Francophone perspective, Isabel? James, over to you.
Sure. Look, I think technical assistance, I don't know if I necessarily characterize something as expensive or not as expensive. I think ultimately it's part of a bigger picture process here where we ensure, that we can get closer to the goals that we're trying to achieve. Like ultimately there needs to be investment in communities, investment in, building evidence, investment in building capacity, facilitating participation, and strengthening partnerships, among other things. And that's, I think, part of a bigger cost here, which is about, from the side of Stop TB, ensuring the right levels of investment for a strong national TB response that can ensure you find and treat all the people with TB, that you respect rights, that you acknowledge equity, and then ultimately that you end TB. Technical assistance is part of ensuring that we have the capacity in our communities and in our other stakeholders, noting that government partners also require technical assistance in many instances, to build the best quality TB response we can and to ensure that people get the services that they need. So look, I think it is expensive, but I do think that there are also cheaper ways as well to do this, and investing in locally rather than the fly-in, fly-out model, making sure that you have that local level ownership so that that TA doesn't just, for example, produce a report or facilitate a meeting, but creates a space and a climate for local level ownership and leadership. I think that that's a way in which you're having short-term investment, which is relatively cheap investment, but can produce also really strong, sustainable long-term gains. Thanks.
Great. Sorry, guys, I totally forgot that we were supposed to only have this discussion for 2 hours. So I got so engulfed and immersed in it, I forgot the timing. So we have 2 people that need to speak, and I'm going to cut short the questions. So I'll call upon John Baku from ENASO to do to give some remarks, a wrap up, and then have Niluka come in and just do a closing remark. Sorry, guys, I ate into your time, but over to you, John.
All right, hi colleagues. Many thanks, Liz, and thank you everyone for joining. And particularly, I really like to appreciate the speakers, the TA providers, for sharing with us the process of how we can access TA. I know it's a bit complex, but I think if you look at over time, I think this process has been made very simple, has been simplified. But overall, I think in our discussions today, we have seen who is there within the region that we can access TA from. Two, we've seen how the process works in terms of eligibility, scope, that what TA is covering, which area is covered, geographical coverage as well. Some TA providers are more present in maybe, let's say, Francophone Africa, and some across the entire region. We've also seen how what targeted recipients that are targeted, civil society organization, communities, networks, community groups, NGOs that are within the HIV, TB, malaria. And I think for UNAIDS, I think it goes beyond maybe to institutional strengthening support. So this, I think that is very critical information. We've also seen that the processes for accessing, each TA provider has given us the processes. That is very, very important, colleagues. And I'm sure we'll have more information on this in terms of write-ups. There are links to each TA provider, and those links provide the process, or what process do we need to get into in terms of the forms, who do we go to, where do we submit them, and how long does it take. So that is very critical information for us. And I think from also all of us as the participants, there are a number of things that have come up, we've seen, and I think these are very critical for the TA providers as well. One is the complexity of the TA mechanism or architecture in itself. Maybe the process is long, maybe the forms are complex. And if we, for example, we are supposed to approach the country director for UNAIDS in that country to request a TA, or we're supposed to have some national level offices, it's also maybe difficult for some of us at grassroots level. So these are some of the things that have been taken up. How do we simplify this? Make sure that it can be available. And some of the questions I was looking at is the TA itself. There's less information. Most people don't understand, or don't have information if this TA paid TA is available. So some of those things have come up, and this is something I think is very critical for this meeting to take them forward and try to see how do we disseminate more information, how do we restructure the TA delivery mechanisms, and how do we make it easy and accessible to colleagues. I also want to let you know that some of your questions that have come up in terms of proposal of TA areas, this is also very critical. So when we share the report of this discussion, these are some of the things that will inform the TA providers. What are some of the TA areas, new ones that are coming up that communities are more interested in? For example, if we are talking about climate change, is climate change covered currently? Pandemic preparedness. Some of these things have been expressed in the Mentimeter. So we'll compile all this, and it will be very useful for our TA providers. In terms of challenges, I think it's just maybe the processes and expensive. I think we've also had a quick response on that in terms of how expensive it is. I think we understand that, and also some of the proposals that to use locally available TA. That would be awesome and very critical and important to ensure that the TA is accessible. Overall, I think we have seen the usefulness of TA targeting to accelerate and maximize impacts of what we do in the grants that we receive from the Global Fund or any other support that we get. TA is just to ensure that we maximize the impact of our work that we do. So giving money alone, I think it has been experienced that maybe it's not enough, but it has to be accompanied by technical support. So many thanks, everyone. So what next in terms of what we're going to do is we're going to compile all these very useful discussions. And then we'll have, we normally have a report, a webinar report we'll share with everyone. That is number one. Number two, as you requested, presentations will be shared. And I think Liz has covered that already, will be shared with everyone. And also the links to the TA providers, where the information about the TA modalities and processes is, that one is also going to be shared, so at least we all have information. And then as the ANASO is going to continue reaching out in terms of sharing new information, and ensure at least we increase the uptake and consumption of TA to maximize the impact of our grants. With that regard, many thanks everyone from our end. I would like to hand it back to Liz.
Yes, and I'm eating everybody's time here. So Niluka, over to you. Make it short and sweet.
Sure. Thank you so much. Especially thanks, IANASO and Learning Hub for organizing this webinar. I think it's a really important topic. For colleagues who joined from L'initiative, Stop TB, UNAIDS, and GIZ, thank you so much for sharing all this information. And, as communities, I really thank you for making all this TA available for us to come together and make a difference in our responses. And for colleagues who joined from different countries, please do apply. Please get the support of Learning Hub and anybody who's available for you to get the support. These resources are there for to ensure that your engagement in different processes are meaningful and effective. So we're ready to support you, and let's use all the resources available to us as communities. Thank you so much, Lizzie.
Perfect. Thank you, Niluka. Thank you, speakers, UNAIDS, Global Fund, L'Initiative, GIZ Backup, Stop TB. Thank you also, Aaron, for just giving your input. Thank you for giving me 5 more extra time of your day, and have a great afternoon, great evening, or great morning, wherever you joined us from. Thank you. See you in the next discussions. Bye.
Thank you. Bye.
Thank you.
Thank you.
Thank you.
Thank you.